The ongoing pandemic has raised serious concerns among everyone, and those with special needs or with existing ailments are most worried among them. Over the last 2 months, we have discussed several such issues with many of India's top medical and public health experts. Today, we will be discussing issues that impact half of our population, and in many sense, it is the most vulnerable one. Yesterday was a special day as the world observed International Day of Action for Women's Health and World Menstrual Hygiene Day, renewing its pledge to protect and promote the sexual and reproductive health of our women. How significant these vows are, and what is the state of affair for women's health in India, especially during the time of these lockdowns. To put a light on these and to answer many of your queries on taking better care of women's health, today we have a very accomplished and renowned women's health expert, Dr. Anjila Aneja. She is HOD Minimal Access at Fortis Hospital, Gurgaon, and Director of Obstetrics and Gynaecology at Fortis La Femme Hospital in New Delhi. Welcome, Dr. Aneja, to this show.
Thank you so much, Kamal, for inviting me for such a wonderful show and such a wonderful event.
Thank you so much, ma'am, for being here. However, before I begin our conversation, I would request our online viewers to keep sending their questions on the comment box, and we will try to answer most of them in the next 30-40 minutes. Also, do like this show and comment with your feedback, and do share this on your wall if you really find your friends too may get benefited from it. So let's begin, Dr. Aneja. Since we are talking on the occasion of these two special days related to women's health, I would begin with a larger public health aspect first. What's your take about condition of women's health in India?
I will say it's definitely getting better now because of a lot of initiatives are taking from all over the NGOs, the world, the UNICEF, the WHO and the government of India, especially with the Swachh Bharat, the Shauchalaya they have made it, and they are publicly going forward with like you just said that yesterday we had a World Menstrual Day, and most of the time the impact comes from the audio visual. I think all of you must have heard about a movie Padman, So I think these social issues, if are taken up by I will say by the media or by the cinema makers, that makes a larger impact. So I'm not going to say that we are 100% better, we are 50% better. I think we are on a right track. So let's see what holds in the future. So it's a basically for us, for a doctors, for a NGOs, for a media person, for a people like you, who create more awareness on a social media. So that's more important. So we are not looking into it, but this should keep on going. The track, we should follow this track in the right direction.
So awareness is important.
Absolutely.
We are trying to do better. We are improving every day as a country.
Who used to make a movie like a Padman,
Certainly. What are the concerns? So important thing, will come to the Padman, or you mentioned about Padman movie, and we had a menstrual hygiene day yesterday. I see around even less than 50% of Indian women are having access to something like sanitary pad. What do you consider? Is it a lack of awareness, or is it lack of access, or we as a nation or society are not able to cater the need of these women, which is very essential to protect their reproductive health, their general health overall?
The basic thing is we are not able to remove the stigma or a taboo which is attached to the menstruation. It's very important to understand, as we grow, we bleed and we conquer. Okay, so this is a normal life or for female child to have it, because everything is related to it. Okay, so still in the society, during the menstrual day, you can't do puja, okay, you can't cook, You can't even take out a pickle or eat a pickle, or you can't eat something cold. These stills are still in everybody's house. If you ask me, even my grandma used to have the same thing. So, but with the time when we were educated, we came to know. So we started saying, like, we don't do it. So we make sure that we try to remove these taboos and these stigmas first. And secondly, people feel ashamed to talk about it. There is no need. But now the best thing is, because of the awareness, even the boys are becoming a party part to it. You know, and in our times, we used to even hide a sanitary napkins. So there is something attached to it which has to go away. But yes, there is a move, maybe in the urban society, but not in the rural population. So one, it's very important everybody to talk about it. There is no stigma attached to it. You don't get dirty. If you don't get a period, a woman thinks that this dirt has not come out of the body. No, it's not a dirt. It's just a lining of the uterus which comes out. Second, and toilets has to be a woman friendly. You know, so even if the toilet, whether it's a college or a school, they should dispense the sanitary napkins or a tampons at a good price, not a. So another thing which comes as a price, it should be economical and it should be friendly.
There has been several such innovations and move where multiple organizations have tried to make it more affordable.
Yeah.
But I think there is also seems to be a larger push from the society to
Yes.
make it available to the the last women at the row. I think uh, important aspect from the public health as point of view also, doctor. We have seen a remarkable decline in maternal deaths in India. We have done very well,
Yeah.
has been recognized by UNICEF, WHO, everyone. And but we are still seeing around 122 women dying, out of every 1 lakh live births. We as a, council, and I believe this whole society should believe in that even one death is too many.
Yeah.
What do you think need to be improved?
The one is the education. Second thing is anemia. Our Indian women are usually anemic because of the lack of the diet, and they don't take iron properly, or our food is not rich in iron. So if one, the most important thing is, if we are able to tackle our anemia, okay, because of anemia, many complication in pregnancy arises. A woman with anemia is even at risk of a hemorrhage, more hemorrhage in pregnancy. So which adds up more anemia to it. Okay, so I will say education. Second thing is awareness. Third is supplementation of iron and calcium to all pregnant women should be made feasible.
So anemia is one such
It's one big
issue,
factor.
big issue
And
is
yeah, yeah,
causing a lot of these damages to the health of women.
yeah.
What are the
And
other major health
you know,
issues?
and they don't lack of, I will say, we should have a little more midwifery led care, especially in the rural areas. And they should, like in India, there is no midwifery, proper a midwifery college which only caters to the midwives, which deals with the pregnancy and the childbirth, and even the postpartum. Like in other developed countries, if you go to UK, you go to Canada, they have a mid everything, even the antenatal program, delivery and the postpartum, they are looked after by the midwife. In India, we don't have that kind of a program. If we have good trained midwives which works in the villages, which works at the primary care center or a secondary care center, we most of us have an untrained eyes there. People are not able to come to it. Of course, with the government of India, their ASHA workers and everything, the things have become much better about it. Okay, but we are in a private sector, we don't come to this kind of patients. But the complications why they go up is one, mm, the antenatal care is not that great, it's much better. That's why we are able to reduce our maternal mortality. Okay, second thing, women grow up during their antenatal time only. Okay, this is a high risk pregnancy, cannot be delivered at a primary or a secondary care center, has to go to a tertiary care center, and that path, that reference path has to be very quick, and it should be struggle free. So identification, assessment and identification of a high risk patient, timely referral to a tertiary care hospital is very, very important.
So universal health access for them during this special time of pregnancy, and then timely referral for all, critical and high risk pregnancy is something which you believe that is key to reduce it further when it comes.
This is a key to reduce the maternal morbidity and mortality as well as the perinatal morbidity and mortality. To check their blood pressures on time, to check anemia on time, just to see for the diabetes and refer them on time.
Doctor, COVID-19, as we said, have created a lot of concern among the women, among everyone. And I think women are not left out of this. And, this segment being more vulnerable. We were, before starting this program, we were also talking with you about, the continuous numbers of deliveries which are happening at your hospital, which you are conducting, because you can't stop that. This is something that has to go. How much COVID-19 has added as a complication related to health of these women, especially those who are pregnant and are delivering during this time?
I will say the thing which has effect is their emotional and the mental health. There is so much of panic. It's a new virus, it's a new disease, has caused a havoc, but it's very important for a pregnant woman to understand her incidence of getting a coronavirus is same as a general population. Okay, but if she gets a corona, her the chances of 80% you are fine, but you will have a mild disease. But if you have it, the chances of complication in a pregnant woman is definitely higher than the non-pregnant woman, because pregnancy itself is immunocompromised. Okay, so I will say, it's not that so many corona positive patients are delivering. If you are at home, stay safe. Wear your mask even if you're going and stepping out, and follow your hand hygiene is going to protect you. Even the government of India has given the guidelines, as the elderly more than 60 years, the children the less than 10 years, even pregnant women should stay at home.
And also follow physical distancing,
Definitely.
hygiene within home also.
Yes. No, within home, if the people are taking care, then social distancing doesn't matter at home. Because, you need to change the culture at your home, Like if somebody is stepping out, needs to carry its own mask, needs to carry their own sanitizer, have a social distance. If you're getting somebody, don't keep people coming frequently to your house. Don't let them. It's not to be entertained. Any fruits, vegetables, there is a protocol to follow, how to wash your stuff, how to go. I think you should already be into this kind of a protocol, because this is almost more than 8 weeks now.
Yes, we do hope that most of the families are following that.
Yeah.
You said that this is a very interesting aspect, because a lot of concern among pregnant women is not only about their infection of COVID-19. When you have a child, you are carrying a child. One important concern which you face is, if I get infected, is it going to be passed on my child? Whether two lives together. I think that is adding a little bit more concern. What's your advice on that? Is there anything to be worried about?
No, I don't think so. You should get worried about it. There is no vertical transmission. Okay, means you can't pass a child an infection when the child is inside your tummy. There is only one case report from UK, okay, which has showed that there is a vertical transmission, means the infection happened to the baby. But we have very less data, but only on one case. There's no need to panic about it. They have done a study on 147 children who were born to a mother who were corona positive. In their nasopharyngeal swabs, including their cord blood, amniotic fluid, it was all found to be negative. So we need to be careful, but we need not to be panicked. And we are not even doing cesarean section just on the basis of only one case report. So there is no need to get panicked on this.
There's one other important aspect, doctor. When you are pregnant, one thing is to be worried about COVID-19 infection. The other thing is when you start seeing some kind of symptoms, which may be of, let's say, common flu. That at this point of time adds a lot of worries to those people and to their family. What's your advice on that?
No, you are absolutely right. This is a change of weather. People are anyway going to get a flu-like symptoms. Okay, but if you get a flu-like symptom during this time, it's not always going to be corona. Okay, but it's very important that you must talk to your doctor about it. Even don't go and visit the clinic. There is no, you can have a corona, you may not have corona. Okay, so whatever your doctor will advise you, you follow that. They might advise you to take this kind of a medicine, this is the time you go and get your test done, then they will book a test for you, somebody can come and do a home collection for you. But in the meantime, you must watch out. If you have a cough, you have a fever which is persisting more than 38, or you have some kind of difficulty in breathing, okay, any loss of smell to your, any loss of smell or loss of taste or extreme fatigue, then you must report.
So the first thing, you need to consult your doctor immediately.
You can even meet her, all the hospitals, I think all over the India or all over the world, they are doing e-consult.
Yes.
Okay, you can just book an appointment and talk to your doctor about it and have face-to-face interaction. That will give you a good factor. And if there is something, your doctor will help you out how to go about it.
And also you need to be mentally peaceful, because many times, despite the doctor says that it is not corona, will be all fine, it's a common flu, people still have concerns.
That's why I'm saying the mental health, mental well-being is very important. So through this, through you people, I like to tell all the patients is, please don't panic. You must drink a lot of water at this time, 24/7. Don't watch television to see how many corona patients have come, how many have died. Spend time on your hobbies. You can paint, you can sketch, you can dance, you can listen to the music, cooking, you do cooking. Or if you're pregnant, you can make something for your child with your own hands, which are you going to enjoy and you will remember also for always. And please uh, put your shoes on, do some kind of exercise, you must walk, everything can be done at home, and eat good fruits and vegetables. So much of heat wave is going on, so it's very important. And now even the locust swarm is coming, so you don't know where you are, so there's no need to panic. Just stay and follow, eat good food, plenty of water, exercise, meditation. And it's important that you must express the gratitude towards your doctors, towards God, even your driver, your helper who is helping you out. So these all things will give you a lot of positivity and help you and keep on going. Don't watch television, I must tell. Please don't. Once a day if you want to see, it's fine, but not every time. How many have come, how many have died, how Maharashtra is doing, how Gujarat is doing, what Delhi CM is doing, So I think please spend your own time on your own well-being.
Focusing on oneself will help more than the word as of now.
And help the poor people around you, which will also give you a lot of good vibes, that you are doing something good during this pandemic.
Doctor, we have started getting a lot of questions from our audience. So I'll start picking up them, and we'll also try to ask the co-related questions as well. There's one very basic question has come, which is one of the major concern among young women especially. What causes PCOD?
PCOD is a lifestyle issue. Okay, most of the time it's because of the bad dietary habits and the lack of exercise. So because of this, you deposit more of the fats, and in your fats, your female hormones turn into a male hormone. It's not that you will become male like this, but you will put on more weight. We all know because of the lack of exercise and bad diet, we put on weight. There will be acne, there will be hair growth, there will be problems with the period. You don't get periods on the time. So I will say the magic wand in polycystic ovary is do exercises and take a balanced diet. Take more protein, avoid less of Take carbohydrates which are complex and avoid fats, and add more of the green leafy vegetables and your flex seeds, chia seeds, and avoid processed foods. And polycystic ovaries is a lifestyle, but this has a metabolic syndrome also. If you don't take care now, in the future, the chances of diabetes, blood pressure, difficulty in conception will come. So this will start from your puberty even till your menopause. So it's very, very important that you crib it now.
There's another related question, doctor, on this. There seems to be a patient taking certain medicine. So they have asked, is oral contraceptives like Dian 35 is the only solution for PCOD patients who have irregular menstruation?
We have a very wide range of oral contraceptive pills with us. Okay, Dian 35 is also one of it. Okay, but this has a little high estrogen content. So this is a very good contraceptive. I'm not saying that this is bad, but what nowadays we do is we don't start immediately with the Dian 35. We have low dose oral contraceptive pills available with us, which not only make your periods regular, they also take care of your acne and your hair growth and everything, and plus your exercises and diet. If you don't respond, then we will go to a high dose and to a Dian 35 also.
One more question on the same thing, doctor. A patient want to ask, can PCOD issue get over after delivery of child?
No. PCOD, I told you, it's like a lifestyle disease. Okay, if after the delivery, if you are not taking a good diet and you have put on weight, then it might not get cured. So what you need to do is, if you have a PCOD patient after the delivery, must take a good diet and do a regular exercises as per your doctor's advice. If your weight remains under control, your PCOS is cured.
So it's you have to manage it.
It's with your lifestyle.
Yeah. Doctor, one question related to menstrual cramps, and viewer want to understand that what are the natural ways to reduce cramps?
Look, the cramping during periods is very common. Why you have a cramping? Because you're ovulating. So if a woman who has a regular period and has a pain which is tolerable, we say it's a normal phenomenon. So what we say is, you drink water, you can take a hot water bottle, wrap in a towel, and take more proteins in your diet at that time. But yes, if it's not bearable, then it needs to be investigated. If it's hampering your work, like this is not allowing you to go to school or to go to your office, or you are in the bed all the time and you need painkillers 2 to 3 times a day, it means then it's troubling you. Then you need to be looked into it, and we do an ultrasound to rule out your endometriosis or any other kind of a cyst into it.
Doctor, this COVID-19, has it impacted the sexual and reproductive health of women also? And is there any disruption which you see in terms of accessing contraceptives or family planning services?
No, there is no disruption of any kind of the services, because that comes into an essential services. Okay, so all kind of essential services are available even now and even at the time of a lockdown. One thing is that. Two, yes, there is no. Another thing is, there's no disruption of any kind of oral contraceptive pill during this lockdown period.
But since you have seen that there have been there are two possibilities. A UN report says that there can be 47 million childbirths or unwanted pregnancies because of the lockdown across the globe. And we also see some of the very positive outcome these days that
many people are becoming pregnant.
Yeah, assisted reproductive treatments.
Yeah.
They are naturally getting pregnant. What is your take on that? For them who are getting naturally pregnant, it's a very good outcome. But for those who are getting subjected to unwanted pregnancies because of any reason.
So let's take about the good thing first. So we all know, when the stress goes out of your mind, how your hormones play, what the stress is, it just haywire, your hormones go haywire, you don't ovulate on time. Once that thing goes away, you're under lockdown, you are not going to go anywhere, and you know that you are not going to get any treatment. So that treatment will start after 1 month or 2 months. So you are not stressed out because you are into that waiting period. So naturally, everything gets corrected, and you became pregnant. Stress is a big, big factor of not making you become pregnant. One. Two, I will say the unwanted pregnancy, you are absolutely correct. But unwanted pregnancy during a lockdown is because of your negligent behavior. It's not because of the lockdown or a coronavirus. Okay. One, if you don't want to become pregnant, then it's very, very important to use a contraception.
Sometimes, there is no that kind of easy accessibility of contraceptives, especially maybe something like your, morning after pills, or maybe the women in the family may not have direct access to buy it, or there is a fear of outgoing, of the home. What is your opinion in that case? And is there any other way of, having a better control on your unwanted pregnancies?
Look, if that's the thing, then there is only one practice I will say, which may be a little abrupt to say abstinence. Okay. But second thing is you can calculate your safe period. The period during periods or immediately after your periods is a safe period, but you can go wrong. It has a 50% failure chances. So it's very important to understand, okay, like unwanted pregnancy is also going to harm you physically as well as mentally. So it's very important to understand that it's the use of contraception is the most important.
And
Either
there
you
are
use condom, put a coil inside, or you take oral contraceptive pill. It's freely available everywhere. All chemists are open, and there's even free home delivery. At least none of my patient has even told me that there is no access to it.
good. So all those who are watching and if have any such question, this can, be rest assured in their mind that the chemists have all the supplies. You need to go and take it. If
Yeah,
they
and
need.
please avoid unwanted pregnancy. This really has a physical and mental impact on a woman's health.
PCOD seems to be a hit topic today from the viewer's side. Another question we have got from PCOD. A patient, he's saying, she's saying that PCOD patient from last 10 years, taking healthy diet, no junk food, doing exercise regularly, but still irregular menstruation. What could be the reason? And she is taking DN 35.
Sometime if you are not, despite doing everything, I'm very happy that you are doing all these things. And if you're still not okay, then we need to add on to other stuff to you. Like if you are married, if you want to have a baby, the treatment is different. If you don't want to have a baby, then the treatment is different. So basically what happens in the PCOD is like there is an insulin resistance, because of that there is an anovulation, means there is an irregularity of the periods. With this there is a metabolic disorder, so we have many drugs which improves the insulin resistance. If you are not responding to it, then we will add these medication to you to help you out.
Doctor, there's another question on from a 38-year-old patient with endometriosis.
Okay.
Pronouncing it wrong because
no, it's fine. It's called endometriosis.
Medical terminology are difficult for us, laymen like me. A cyst on the right ovary with a size of around 9 cm and by 6 cm. The patient want to understand what are the treatments available. Is it possible for you to suggest a treatment on this?
Yeah, 9 centimeter into 6 centimeter is a pretty big cyst. It's very important to know what are your problems. If you wanted to plan a baby or something, then you need to get a surgery done and get this cyst out. Okay. And if it's, or you are having a lot of pains and everything, even then you have to get it out. But I will suggest you during this corona pandemic, as there is an increase in the number of the cases now in India, as we are looking forward, I will say you can even take a medication to for the time being till you get okay, and or you get a surgery done. You know.
Good. I think this question has been addressed, and the patient would take this advice and will look for a more consultation personally with her doctor or Dr. Aneja. Post they are they can consult at the hospital. Doctor, one important thing when we were talking about unwanted pregnancies. Uh, Adolescent girls are one important group
Yeah.
where unwanted pregnancies can be a major problem,
Yeah.
and uses of contraceptives methods such as pills or injectables, morning after pills, uh, people have sometimes some concern that does it have some impact on their health, long term health, if they are on these contraceptives during these early age.
Okay, so let's see about the risk versus benefits. If he is an adolescent, she is taking oral contraceptive pills to prevent her pregnancy. Okay, so this time she is being benefited because she is being avoiding the pregnancy. But it's very important, along with the oral contraceptive pills, if they are not into a stable relationship, okay, then they must use condom to prevent a sexually transmitted disease also. Okay, and you can take this pill under a supervision of a doctor for a very long time. If we need it, we can give a break also in between. Yes, there are the side effects of the pills also. If you, for example, if you take it for more than 10 years, then the chances of breast cancers are there. But if you stop it, then they will revert back. Okay. Second thing is the risk of clotting in your legs. We call it deep vein thrombosis or pulmonary embolism. The risk of that is roughly is 1 in 30,000, which is also very rare. If you become pregnant, then the risk of getting deep vein thrombosis, if you are prone to it, is much, much more when you become pregnant. Now let's see if adolescence becomes pregnant. If an adolescent girl becomes pregnant, it's too much of emotional, mental, physical trauma to a girl. So this is very important that we should weigh the risk versus benefit and look into it and protect our young girls from getting pregnant with an unwanted pregnancy. So they must use contraception, and oral contraceptive pills are the best one for them. One, because the contraception is in their hands. Okay, which will make their periods also regular. They will prevent them from pregnancy. They will prevent them from their acne, hirsutism, and they increase their hemoglobin also. So there are many good advantages of taking oral contraceptive pills also. But I always insist, please add condom. Tell your partner to use condom so that they are also a part of a contraception together.
Thank you, doctor. We talked about some of those good developments of people getting or women getting pregnant naturally. uh, there may not be everyone that lucky, and there may be a number of couples who were going through a certain IVF cycle or seeking IVF help, and post these lockdowns and especially these COVID-19 restrictions. Uh, are they able to continue that natural cycle of IVF? And if not, what is your guidance for them? When to restart? Do they need to start from the beginning, or it can be picked up from it is left?
So when this lockdown happened, the guidelines came in. The one who were into the egg retrieval, their egg retrieval was done, but embryo transfer was not done. Okay, so embryo transfer will done when this COVID will become better. Okay, the countries where there is a plateau and or where there's a natural downward trend for the COVID, they have started with the guidelines. Look, I told you earlier, it's a new virus, it's a new disease, so we don't have a scientific evidence how good or how bad it is for an IVF. Why? Because if you are retrieving an egg, we are giving anesthesia to a patient, and once we are doing an embryo transfer, we are doing it under sedation. So till now, we were avoiding any procedure unnecessarily under general anesthesia because the number of asymptomatic carriers are also very high. And we all know in corona, our lungs get bad. So under general anesthesia, if you are an asymptomatic carrier, your morbidity or mortality increases if you are getting a corona. So that was the reason all these procedures were stopped. So we are waiting for the guidelines. There are lots of guidelines which are coming in, and slowly people are going to start it, and the doctors are going to get back to them. But I'm sure they are going to do all the COVID tests for all the patients before they do any kind of a procedure, because these are not emergency procedures; these are elective procedures, and
So
we don't want any patient to get infection from the hospital, or
it's
they give infection to others.
so it's better to wait as of now and consult your doctor, follow the guidance of the doctor uh,
Yes,
who
yes.
you are consulting for your IVF procedures.
Yeah,
They
because
will be
all
happy.
yeah, because all the IVF people are getting prepared now. They are coming with their guidelines. They are working on the guidelines. They like, for example, even in an IVF lab, I just want to say, like, nobody is even allowed to use a perfume. There is no because the embryo gets dead. So all the sanitization process has a chemical into it. So what even the IVF people have to say, what is the safest way they can work. So give them some time so that they can come up with the best of the practices, which are also getting ready made now. So they're going to come very soon. But it being a new disease, give it a little time. So I think by June end, we should be much better with the situation.
Doctor, two more things. One is that these are lockdown little extended. This is not a 10-15
No, no.
days. Maybe it is going to continue with certain restrictions for longer. Uh, Many of the girls might have hit puberty at this time,
Mm.
or many of the women might hit the menopause at this time. What is your overall tips for them? And if it raises any kind of concerns in their mind and they are not able to, or they feel that they are not having that much access to the doctors.
Basically, that's a mental health is very important. As I already said, the meditation, the exercise, plenty of water, build up your immunity, go into more kind of green leafy vegetables, fresh fruits. These all are going to help you out. And don't think the doctor are not available for you. You can book e-consultation, video consultation with your doctors anywhere, and just go on. This is going to be a part of our lives, corona, for next 1 or 2 years. So don't get scared. We are all there to help you.
Thank you so much, doctor. So, here we have spent almost 39 minutes of our discussion, and it was wonderful talking to you, doctor. We tried to address as many questions as possible. We had got a lot of questions before the show also. So, wrapping it up, here was Dr. Anjila Aneja from Delhi answering your questions on various aspects of women's health. If you have more questions, you can send them to us through WhatsApp. To use, click on the WhatsApp button on ISW Facebook page. Also, don't forget to follow us to stay updated on all that concerns your health and well-being. You can also get quick responses to many of your questions related to women's care at Ask Tanu FB page through instant chat. This program was supported by Bayer Zydus Pharma under its public awareness initiative, Bayer for Women. We will be back with our another special show on women's health care next week. So keep sending your questions and we will certainly include them in our next show. Request our women audience also to keep your health first. A healthy woman is the backbone of healthy society. As Dr. Anjila Aneja said, focus on your mental health, mental well-being. Keep your health on priority. Decide what is good for you. Eat healthy and sleep well. Keep giving your mind and soul a daily dose of positive thinking, not to spend much time on TV, or when at a time when you see negativity rampant around you. And don't forget to maintain personal hygiene, physical distancing to protect yourself and your loved ones from coronavirus. Goodbye and see you soon.